It's pretty high even right now. I'd say 140 over 95. So you're maybe a little bit above 140. I know, obviously, nerves are on video, and so.
No, but usually it doesn't go down. I don't know why it doesn't go down.
Oh, you okay? That hasn't moved in a while. That was beautiful. There we go, right there. Should feel a little easier now. I always find that after I'm combed, the next time I get massaged right after, it's like, oh, okay, it's not as tender. A little bit. It's like 130 over about 85 now.
That's
about
bad.
Like 10, 130.
That's very good.
Definitely a little lower.
That's a lot.
That's a lot.
I got your MRI report here. Just in your words, tell me what you're feeling.
Like over here, right there, in the middle right there, and this thing I can feel it, it's swallow. It's like every time I move, like I can be washing dishes, I can be cooking, and I have to stop because it goes all the way to my hand.
Burns? And then you said the ring finger on the right was going numb?
Yes.
And you wake up with your hands numb? Okay. How is it numb right now, the right hand?
No.
Okay, but
I can feel it like
kind of tingle.
Yes.
Okay. So some paresthesias there on the right hand. So you had an MRI a couple of years ago, and you've been through some treatment with, I think, physical therapy, you said?
I went to physical therapy, I went to a pain management.
Tell me about that. Yeah, tell me.
The pain management, the only thing that I did was to inject me there.
Right.
That was painful. Like I didn't want to go back.
Okay.
But it didn't do anything. I went back to them, and that's why they recommend me to inject me again. I didn't want to do it. I took the next route. They were physical therapy.
Right.
But physical therapy is not helping either. Like I did that for a few weeks, and it didn't help me either.
Okay. So part of what we just talked about a little while ago was that you have 24 vertebrae, and what's likely happening is that, what is happening is that your lower neck is doing too much work. When we do a therapy or exercise, it's very likely that you just continue exercising the small percentage of your back that's already working. So we have to go through your spine, get it all working, take the stress off your lower neck. Your MRI report talks about C5, C6, C7. The lower neck vertebrae are more worn out than your upper neck. So your upper neck is relatively young, your lower neck is relatively older, and so we want to move the stress to your upper neck, to your upper back, away from where it's inflamed. You also said you had some ringing in that right ear, and that's been going on for how long?
Not that long. It just, let's say, when the pain go over here, I can feel it all the way to my head. The doctor said that doesn't have nothing to do with it, but every time it happens, I cannot sleep very well.
What I was also noting on your report is it looks like there's two injuries. Your neck right now likes to tilt left to get away from that right side, so it's trying to open up. I showed you on the model, when you tilt the spine to one side, so to tilt the spine left, the hole on the right gets bigger. So when you're pinching a nerve on the one side of your neck will just go like that to, I feel bad. And even with the tilting, it's still symptomatic. And so many times when your head's tilted, it makes you dizzy, so you drop a shoulder, and so then it looks like your shoulders are unlevel, but it's really a head tilt. Now, what can cause the overstressing in the right side of your neck in the first place was that there's an injury on the left that your head tilted away from. Now you injure the right side, now your head's trying to find holding a hot potato. Your body's trying to find somewhere
You're right, because I was like this, trying to get away from the pain from here.
Right. And there's a couple dominoes in there, but what I also felt briefly on your neck was that she's got some lymph nodes. There's those bumps in your neck. Those are the sewer pipes that drain your ear. So your ear, your nose, your sinuses all drain down your neck. Because your muscles are tighter, because your head's tilted, those drain lines are being crimped. So you're going to have the collection sites all inflamed in there, and even affecting your ringing in the ear. You've been taking blood pressure medication?
Yes.
How long have you taken that?
Oh, I've been taking probably for a few years already. For around 5, 6 years.
6 years. So I was explaining a little while ago that the upper back, the cardiopulmonary nerve in your upper back on the left side, right here, is where the nerves that go to your heart that speed it up. So, and this is an area you said was pretty tender. So having tenderness in your upper back can cause a false signal to your heart to speed up. Your brain didn't necessarily send the signal. There was some interference because there's soreness, which activated the nerve, just like you're having sensation down your arm, it's false. You're having some false signals being sent to your heart to speed up. The medication they give stimulates the brake pedal, which is effective at lowering your blood pressure, but it doesn't get to the source of why your blood pressure is elevated in the first place. There's a correlation between the symptoms that you're experiencing and inflammation, stiffness in your upper back, which then affects the nerve that goes to your heart. So I'd like to take your blood pressure, check it kind of before and after. I'm just curious if it's going to be changed at the before and after the visit. You said it's probably, I was thinking it was probably already pretty good right now because
I
you
already took my
medication.
Yes.
But I'm just going to check that real quick. The speed of your heart goes up, but also the muscles in the arteries are controlled by that nerve. So they're going to constrict, increase the pressure because the nervous system controls your circulatory system, the function of it. So.
That makes sense.
So yeah, it's pretty high even right now. I'd say 140 over 95. So you're maybe a little bit above 140. I know obviously nerves are on video, and so
no, but usually it doesn't go down. I don't know why it doesn't go down.
We're videoing it right now. So but again, I'm just curious to see at the end of the visit. It's elevated. I mean, they would consider anything above 140, to be high blood pressure. Well, actually, I think they just lowered it to 130. But my point is that the numbers for what normal blood pressure is have changed over the years. But it definitely is more than where I think it should be. So as I work on you today, I'd like to check that at the end and see if that changes.
Supposed to be supposedly 120 over 80.
Okay.
Yeah. It's definitely higher. And have you cross this arm under. Bend both the knees for me. Just keep them on your back, but just bend them. There you go, perfect, you got it. Help me do a sit-up for me, help sit up. Deep breath in for me. Head back for me. Let all the air out, let it go. Deep breath in for me. Head back for me, exhale. There we go, deep breath in, one more. Let it go. Yeah, real tight up there. We got work to do. So right in the area where the nerves that go to your heart come out, no movement. So the motion is lotion. Movement is what cleans the tissue. So the area being so tight from your posture, the head being forward puts a lot of stress on your upper back to work harder. So we're dealing with about 2 inches, an inch and a half, 2 inches forward. Your ear, external auditory meatus, should be over the center of your shoulder. And the head is forward from where it should be because, like you said, you work a lot of looking down and 2 kids and life. And so our body hasn't reset back to the upright position. There are ligaments on the front part of our body that have to stretch to allow us to be in the right posture. The back ligaments have stretched out so much because of forward posture that our body doesn't reset to the normal position. All right, take a deep breath in for me. Exhale. There we go. Let it go. Exhale. Right, other side for me. Good. Exhale. Oh boy. There we go. Good. Let's go face that for me. Yeah, everything's over to the right. So your head's just in left tilt. It's trying to get away from this right side. It's all puffy on the right. We have to get your upper neck, like I was explaining earlier, 60% of the work of your neck is designed to happen at the top. So if your upper neck is stiff, the lower neck is going to be aggravated. It's going to be overstressed to triple or quadruple what it's designed to do. We need to restore the original motion of your neck, which is your upper neck is the loosest. Okay, we'll get it. Just right up here, I mean, way too tight. Wow. Just a lot of resistance up here. I got you. Let me feel this right here, right there. At this side, let me hold your head, I got you. There we go, one more time. Let me have it. Let it go. Okay, it's okay. Yeah, real tight up there. I got your head. Relax this side right here. Let it go. There you go. Very good. You okay?
Mm-hmm.
All right, very good. That right side is farther from where it's supposed to be.
Mm-hmm.
That's why it didn't want to really move. The left side is closer to where it's supposed to be, so it adjusted easier. But we got to work on this right side. See that right there, babe? That's the actual lymph node. Right there. It's just a clogged drain line. The lymphatics don't have a heart that pumps them. It's pumped by mobility. So if the joints are stiff or the muscles are spasmed, that makes sense because their body's not in the right position. They crimp or block the ability for those drain lines to flow, and that causes things to back up and ear problems, sinus problems. All that can happen because our spinal health isn't what it should be. It's going to be a little boring. It's just me kind of just cleaning this out up here. It's just got to be coerced now. So I asked it to function the way it was designed to function, and it pretty much stuck its tongue at me. It said, no, I don't really do much work around here. I kind of am the one that slacks off. So now we have to work the tissue and coerce it to function better. Your chin go up. There you go. Now relax your neck, though. Your neck, it's such a foreign position. Your neck isn't used to being curved, which is why you're here. The discs are bulging towards the back because the front part of your spine is under such immense compression. So to alleviate those disc injuries, we need to depressurize and open up the front part of your spinal column. Just your neck isn't used to arching back that often. Yeah, right there. Wow, a lot of tension. Knuckles, oh no. That's all got to get out of there. Wow, powerful. Nobody should ever tell you that your core is weak. You have so much power, so much strength in here. It's too much. It's too much power. There's no suppleness. You've lost this, what was supposed to be flexible and malleable has become rock hard, cement.
I feel it too.
Oh my. Being right over it real quick, it comes out right over that lymph node. That's where it's all trapped. Okay, when your husband sees your neck, he is going to be concerned. Based on how quickly it's already pouring out of there. Kind of grainy, right? Kind of gristly. It's supposed to be smooth, no speed bumps. No potholes. So your body's trying to compensate and find relief based on tilting your head, and the consequence of that is that the muscles have been much tighter than they're supposed to be, and then that consequence is that it blocks up the drain lines. It prevents things from flowing properly. Like your neck was waiting for it to be cleaned. Somebody help me. Like one of those cars that says, wash me on the back. Yes. A little smoother. It's a little smoother, but it's still not good. It's still, both sides are not, I'm not happy with, but this is not as, it's going to be half. About half. Yeah, right here's where the nerves that go to your heart, right here. T1 through T4, left side, cardiopulmonary nerve. Any inflammation in here is going to cause excitation to your heart, increase blood pressure, increase heart rate. So our world doesn't connect the dots for us that spinal problems cause organ dysfunction. That your organs are really just reading the teleprompters or listening to the instructions that the brain communicates to them. And so what happens if those instructions aren't clear? Well, the organs don't work properly or dysfunction. And okay. How sore is that? You okay?
I'm okay.
It's okay? Okay, a little sore. Okay. All right. 2 kids, man. I'm tough. What do you got? I'm gonna keep going deeper and deeper. If I'm going too hard, please let me know, okay?
Okay.
Okay. There we go, right there. Too stiff in here. Feel that right there? Kind of the brassiere, the bra participates in encouraging this area to be stiff. It binds up this area. And the cliff notes is that we have to participate in keeping the middle back joints flexible because the bra is a brace that binds up the middle back, so we have to, there's stretches or getting adjusted here to keep this area limber. There you go, breathe. A lot tighter on the side, huh?
Mm-hmm.
Yeah. Like let your shoulder go. There you go. Just guarding. Your body is expecting another injury to happen, so it puts up walls, defenses, fortifications. Got to tear all that down. You need like an hour in here. Just try to let it go. It is not an insignificant amount of tightness. Anybody ever dug in here before? Not so much? No? Nobody's cleaned me out yet. It's this section, T1, 2, 3, 4, this section right here. It's where the nerve roots that form the cardiopulmonary nerve come from, and any acidity or inflammation in here has the ability to affect your heart. Ever had gua sha? Never any combing before? Never had this kind of comb before? Okay. How's it feel? How would you describe it? Does it feel good?
Yes.
Yeah, I kind of enjoy it. Some people, when they watch, think that I'm going crazy, but it's not that much pressure. It's just a combing of the skin, and then it brings blood in. There we go, right there. Should feel a little easier now. I always find that after I've combed, the next time I get massaged right after, it's like, well, okay, it's not as tender. It's not as sore because you've worked some of that lactic acid, that inflammation, that cytokines that cause pain. And then eventually, as the care progresses, that nothing hurts. The tissue should be able to be massaged, adjusted, combed, stretched, and you just go, piece of cake. No pain. This is all like plaque, all build up. Not the butt, Ed. Anything but the butt. Right there. When I had you on your side and we rotated, I was trying to adjust this joint, so I noted that they're both somewhat restricted. Part of that's from giving birth, part of it's just life and work. But we want to, for the sake of your lower back, we want to keep this joint in the game and working efficiently, and not just wait till your lower back is in distress before we treat it. It's already showing signs that it's tighter than it's supposed to be. So because it's tighter than it's supposed to be, the lower back is going to be under extra stress because this down below is not as loose as it's supposed to be. Right there. Ooh. Right. She's tough. Or she's got a really good poker face.
Look, I have my 2 kids without no epidurium.
Very good.
Natural birth.
Look at you.
There you go.
Yeah.
No poker face, it's real.
Even the hamstrings, man. Whew. There we go, nice. A little bit. Oh. You okay? That hasn't moved in a while. That was beautiful. There you go, another one. Nice. There we go. Nice. Okay. Wow, very good. Is okay? You okay? Okay, yeah. So the mobility of the vertebrae helps wash the tissue. So now the tissue kind of can autonomously clean itself because the bones are moving. That's like the engine, the piston going up and down. The motor is now running. All that massage and gua sha was just a means to help achieve just that. That was the whole 20, 30 minutes is to get that bone moving. We first work on you cold, right? I didn't massage you. I wanted to see who was working before massage. That tells me how your spine was working before you came in here. Breathe in, it's okay. Just going a little deeper. Exhale. Okay, a little elbow. There we go. Shoulder. Deep breath, exhale. Let it go. Push your chest forward. There we go, a little bit. Yeah, nice. Okay? All right, very good. You can put your arms back down. Okay, all right, so here's you.
Oh my God.
Yeah, it's all that, remember that left side, it's all that bruising, that's what affects the heart. Epsom salt later today. Gotta get that out of there. Okay. There we go. I got you, there you go. Good, okay. I got you, I got you. Let it go. There you go, good. There you go, nice. All right, let me have you sit for me. I'm gonna check that blood pressure again. A little bit, it's like 130 over about 85 now.
That's
About,
better.
like 10,
That's
130
very
over.
good.
A little
Definitely a
bit.
little lower.
That's a lot.
That's a lot.
But yeah, it's all from that back. Really good. Yeah, definitely
Wow.
lower. Yeah, it's from.
How do we prove it so people don't say you're lying? Can you show them? No, you have to like do.
I have to have a digital one.
Oh,
I have
we should
a
get a
digital
digital one.
one. One day we'll get a digital one. Many times patients, as we clean that, they'll have to actually start taking less blood pressure medication because the medication keeps slowing down your heart. And if we get the pressure off the throttle, then your heart starts to go too slow and then you, what we're dealing with in there.
Oh, wow.
That's all that. So yeah, this is what's pinching the nerve. The nerve radiates down your arm. So even the mark, when you look at the mark, these are more red. This is like dark, very old. The older blood has been trapped there. This is less old. And then let your legs go straight. And take your hand and press it into your forehead to get your head to sink in. Let your head go back. Is it okay? And then put your hand back down your other side. You want to get your head, bending over it. There you go. And then relax now.